I feel that migrants being portrayed, being demonized in the media has a very indirect and direct impact on their health and well-being. There are lots of ways that they get impacted. But again, I'll just narrow it down to three. It has a huge mental health impact. So this constant exposure to negative stereotypes, being framed as a burden or as a threat, it just increases stress and anxiety and depression. And then this, of course, then has, an impact on people's physical health, which means then they avoid accessing healthcare because they don't want to be mistreated, they don't want to be judged or being reported to migration authorities. And we know that that's what happens sometimes. And then it has a domino effect. And this impacts your social and well-being as a migrant. Demonization fosters hostile environments, as we can see. It makes it harder for migrants to feel safe in the communities that they've settled in. And then there's an impact economically. If you think of the cost, eventually what happens is if you don't access healthcare, you just get really, really ill and then end up in emergency care. And then you have, there's hospital beds that are being taken up and all of that. So what would you rather? That people access the healthcare properly, or they end up in, needing much, much wider care. So in short, demonization of migrants doesn't just harm public perception, it creates real, lasting and immeasurable health inequalities amongst the migrant communities.